name is Nurse Choma. I am the founder of Choosing Nursing over at choosingnursing.net, where we help you to pass your NCLEX exam. I am a registered nurse. I graduated from San Diego State University with my Bachelor's of Science in Nursing degree in May 2010. So I've been a nurse now for over 8 years. I practice med surgical and tele-nursing for over 4 years, and then I practiced about insurance nursing for about a year, and then now I've been helping people to pass their exam for 3 years, and it will be 3 years. It's been 3 years exactly this month. I started doing this literally 3 years, June 2015. So I am excited to be here today. We've had many testimonials, at this point now, hundreds of testimonials of people who have passed their exam after receiving my help. What makes us different is that we like to focus on individuals who are struggling to pass their exam, those that have taken the exam 3 times, 4 times, at whatever number of times it's been. We're here to definitely help you. So we've had great success. You can go to our website, choosingnursing.net, to learn some of our testimonials on there by going to the testimonial section. I would encourage you to go ahead and like the page right now, so that way you get a notification whenever I come up live. So and that way you don't miss any of these teachings, because I promise you I give you great information. Also, you can also follow me over on Instagram. I'm over on Instagram, choosing_ over there. All right, choosing_ nursing. And you can follow me on there, and you can also follow me over on YouTube as well, also Choosing Nursing. And then finally, you can follow me on Pinterest, which is Choosing Nursing on Pinterest. So those are all the platforms as far as like nursing wise that I'm on, where I give you that type of content that you need to really succeed in this field. Because I don't know about you, but you need encouragement to be able to finish nursing. Nursing is not like any other career, right? So you need to see something that will keep you encouraged. So pediatric disorders, because I know one of the areas that a lot of people are not confident in is peds. I don't know about you, but when I first started into it, I wasn't super confident about peds, because it's like babies, and you're giving them meds. So it's more, you have to be more careful, because you can easily hurt the child. So you have to be more careful. So I'm going to go over 5 pediatric disorders with you, okay? So I want you to get comfortable with peds. All right, I do want you to be, because it is a portion of the exam. What I've seen for some people is that they take the test, and when they took the exam, they got a lot of peds questions. They got like a whole bunch of pediatric questions. So and then they didn't pass the exam. So they're thinking, okay, that's my weakness. So I want you to be comfortable with peds, right? Because you can see that on the test. So I'm going to go over with you 5 today to help you feel a little bit more comfortable when it comes to peds. I'm going to give you five disorders, ones that you definitely got to know. What this will do is it will lay that foundation for more. So that way, okay, now I understand what I should focus on, when it comes to peds. So I understand, so that way you'll understand more pediatric disorders, And one thing I'll tell you too, it's not hard. It's not hard. The reason why it seems hard is because you're trying to learn all the information at once, but you're not creating first a foundational ideology to grasp the foundation. Meaning that it's like me trying to teach you algebra, right? But then you haven't really learned addition. So I'm trying to, the algebra is going to be confusing because I haven't created that foundation with you with addition. Same thing when it comes to this information. So the first one, number 1, is pyloric stenosis. So here's the thing. Okay, the better you understand how the body normally works, the easier this will be. So this is what happens with our body. So you have the digestive system, right? So what happens is that we eat something, it goes down through our esophagus, and then it hits the stomach, right? Once it hits the stomach, then from the stomach it goes to the small intestine. That's how food travels through our body. So here's the thing though, there's something called a pylorus, all right? It's like a valve. It's a muscular valve. And this valve is located between the stomach and the small intestine. Okay, hopefully you're catching so far. So this valve that's where it's located. But the problem though is that a baby, usually it's babies where this occurs in, it's because it's normally it normally occurs like congenitally or within about 3 to 5 weeks of birth. So usually what will happen is that this valve, that's the pylorus, for whatever reason, it's like thicker than normal. It's like really thick. It's stenotic, meaning that it's closed up. So instead of it opening, right, to allow food to pass from the stomach to the small intestine, it's instead thickened and stenotic. So the food is not passing normally. So that's why they have pyloric stenosis. All right, so pretty much it's just that this valve is just like it's like thickened, it's like it's stenotic, and it's not passing like the way it should with a baby that has pyloric stenosis. So here's what happens. Okay, for that reason, the symptoms that the baby has it's very, very unique. The number one hallmark symptom of pyloric stenosis is going to be projectile vomiting. Projectile vomiting. So meaning that, just kind of think about it. Imagine that my fist is a stomach. Just imagine that right now. My fist is the stomach, and then my finger right here is the valve. Okay, just remember that. Just imagine that right now. So my fist is the stomach, and then this is my this is the pyloric sphincter. All right, that's what it's called, the pyloric sphincter. So with somebody who has a normal pyloric sphincter, right, it will just open and allow the food to pass, right? So it will just open. Just pretend like this is opening. But unfortunately, though, with somebody where the valve is stenosed, it's like the food is trying to go, but it's not. It's stopped, right? So for that reason, when food goes down the stomach, what does it do? It just vomits it up really, really fast. It like ejects it really fast, and because of that, they have projectile vomiting. That's the number one hallmark sign with them. Also, as well, they may have like diarrhea, that kind of stuff. But usually, for the most time, that's the number one thing. Also, they're gonna experience because of that reason, they're gonna be very hungry all the time. They're gonna have persistent hunger. They're not gonna be able to gain weight. You know, those are some hallmark signs of somebody with pyloric stenosis, right? They're not absorbing the food like they're supposed to. It keeps throwing up. So the way that we treat this, remember I said 3 to 5 weeks. So it's early in birth, right? Usually it shows up early in birth, as soon as they're born. Okay, so the way that we normally treat this is by doing what you call a pylorotomy. So what they're gonna do, the doctor goes in, and they cut, all right, and they create an opening so that way it passes through. That's the procedure they do. They just go in and cut, all right. That's why they have pyloric stenosis. So you see what I did right now. See how I explained to you how the stomach happens and the sphincter, all that kind of stuff. That's the patho, right? That was the patho. The reason why some of you cannot remember, or you're confusing, or you're not able to retain the information as far as the content, is because you're not confident with the patho, right? And so that's why you confuse some of the diseases between each other. So learning that let me ask you right now, learning that information, doesn't that help you to remember it faster? Like now you're not, oh yeah, okay, like okay, so that's what's going on between the stomach and the small intestine, right? So I don't know if I wouldn't say if it's an olive shape. I mean, I guess you could say it's an olive. I don't know. I'm not sure if I would classify as an olive shape, but it's pretty much like there's like like that valve though. It's not. It's like it's thickened though. So I don't know if I guess maybe you could say it's an olive shape. I guess I don't think about the shape. I just think about what it does. But yeah, so you see how the difference that makes? So that's why you have to get comfortable with the patho. Otherwise, you're going to mix up the symptoms. And you'll mix up the treatment, right? Okay, so that's the first one. That's number one. Second one, Hirschsprung's disease. This is a condition now, this one's also congenital too. All right, so this is where instead a portion of the large intestine, which is like the colon, is for whatever reason it's like ischemic or it's like diseased. There's not really a specific cause as far as like why this happens. Sometimes it can be inherited, but the nerves though, for whatever reason, they're not able to, so this is what happens in our body or in our digestive system. It does something called peristalsis. Peristalsis is the movement, right? The movement of the stool and everything to pass throughout the body. But for whatever reason though, there's an issue with the colon though, where it's not producing normal cells to be able to do that activity. So as a result, a portion of the colon, it's like diseased. So they're not able to pass stool like the way they're supposed to. Okay, it doesn't pass very well. So as a result, because the stool doesn't pass very well, similar symptoms in the sense that they're not gaining weight. Their stomach is going to be more swollen, right? See how you see the symptoms are different now? Their stomach is more swollen. They will also throw up, but their throw up will look more like green though. It'll be like a green, brownish color, that they vomit and everything. But they're not really passing. If they do pass anything out of their rectum, it's gonna be more like, very liquid. It's not gonna be a whole lot coming through. So you're gonna see them. They're gonna vomit like a green brown substance. Their stomach will be big, and then also they're gonna not be able to gain weight very well. Okay, so with this one, the way that we treat this one, once again, like I said, it's congenital. The way that we treat this one is that we're going to pretty much do surgery again. Okay, we're going to do surgery again. So, but here though, now we know though the surgery is in where? The colon, right? In the large intestine. So this is when we may do a colectomy, right? And depending on the degree of how much is diseased of the colon, how much of it is not is ischemic, or ischemic or diseased, that's how much they're going to remove and do like what you call anastomosis, which means that they're going to reconnect it together. In some situations though, they may need to have a colostomy. All right, so this is so in some situations though, they may have to do a complete ostomy, and now they have a colostomy. Like I said, Hirschsprung's disease is usually congenital. It's not something that usually we see in adults. Something that's usually like that occurs at a young age. Okay, when they're babies. All right, so that's what Hirschsprung's disease. The issue is occurring in the colon now. All right, in the large intestine now, right? And so as a result, let me give you the specific type of language that I like in here. The nerves in the colon control the muscle contractions, right, that move the food throughout the bowels. But for whatever reason though, these nerve cells are not forming correctly in the colon with somebody who has Hirschsprung's disease. Okay, so that's why their stomach is so big, and that's why they're not, going to the bathroom like the way they're supposed to. And that's why we need to do a colostomy or ostomy surgery.